Regular visits to your gynecologist, the exams and tests that are done can help find problems before they start. They can also help find problems at their early stages when your chances for treatment are better. My name is Dr. Ipeleng and I make videos about women's health. So please subscribe to my channel, comment, like, share, and by so doing, you are helping important messages like this one to reach as many women as possible. It is recommended that every woman goes for their gynecological checkup at least once a year, and it is actually recommended that from 13 to 15 years that young girls should go for their first gynecological checkup. So how do you prepare for your gynecological checkup? There's no special preparation that's needed, but you might want to book your checkup when you're not on your period for your own comfort. You might also want to empty your bladder before the examination and prepare any questions that you might have to ask your doctor. And so what happens when you get to a gynecologist? First of all, especially if this is your first visit, your doctor may be interested in taking your personal history and your family history. And all of this information helps the doctor to decide the kind of treatment or the kind of test that you might need. When it comes to the family history, they will ask about conditions that run in your family. And when it comes to you, they will ask about the conditions that you've had in the past or that you are having. They will also ask about the operations that you've had. They will also, want to know the kind of medications that you might be on, and also assess your lifestyle, if you are a drinker or a smoker or if you use any kind of drugs. And then your doctor will discuss pregnancy planning and birth control. If you don't want to get pregnant at the moment, your doctor will recommend some of the birth control methods that are available and which one will be suitable for you. If you're already on birth control, your doctor will make sure that you are happy with the kind of birth control that you are on. And if you're trying to get pregnant, the doctor will discuss with you the kind of pre-pregnancy preparation that you need in order to have a safe pregnancy and delivery. And if you are planning to get pregnant in the future, your doctor will discuss you things like, the timeline. When is it safe to be pregnant? Looking at your age and stuff like that. And if you're already menopausal, the doctor will discuss with you, the symptoms of menopause and how to better take care of yourself during menopause, recommending exercises and diets and some of the medications that you can take to alleviate the menopausal symptoms. So let's talk about the physical examination. When you get to your gynecologist, usually there's a third person there called a chaperone. It could be a nurse or a healthcare assistant. You will first start off by going to a separate room. If there's no separate room, behind the door where you are able to take your clothes off in privacy, and then you'll be given a gown or a skirt, and then you proceed on to lie on a table, which is the examination table, and then you put your legs at the ends of the table. Most of the time there is support to support your legs, and the examination starts basically by examining your vulva to make sure that the skin there is okay and that there are no discharges. And then the internal visual examination, because you cannot see your cervix and even the inside of the vagina by just looking outside. This is the part where a gynecologist is going to use a metallic hinged object called a speculum. Nowadays, plastic speculums also exist. This helps to visualize the cervix and also the walls of the vagina. The doctor will assess how it looks like in other countries, and where I'm working at the moment, there's a colposcopy, and a colposcopy is like a microscope. Basically, it kind of enlarges the size of the uterus when you are looking under a microscope, but it's not a microscope, but it's similar. And they will use your colposcopy to visualize your cervix. And also, this is the time also where the pap smear is done. A pap smear is a test where they take the cells of the cervix, using a brush from the outside of the cervix called ectocervix, and also from the inside of the cervix. They will, scrub a little bit and put the cells on a slide and take them for histology to check for cancer, or precancerous cells. this is a preventative measure that is done every year and it's very important. This is why it's important to go for your gynecology checkups, because this is the part where we can find out that you might have cancer, or that you are, that you may have cancer, or you might have cancer in the future, and necessary measures can be taken to prevent this from happening. Or if you already have cancer, you can be treated whilst it's still early. If you have any pains during your speculum examination, or rather your pelvic examination, you need to let your doctor know that, hey, I'm in pain, and they will stop and then ask you questions, and or make sure that they examine you. They're very careful and gentle with the examination. You need to relax, because the examination is much better if you are relaxed and you are calm. It will be less painful for you as well. The bimanual examination, because your uterus again cannot be seen by just looking outside your body, the doctor needs to examine by putting two fingers inside and then one hand on top of your abdomen, and then palpating to feel the size of the uterus, and also to feel the ovaries, for any kind of enlargement or any kind of growth or any kind of tumor. And before they do that, they'll put on gloves and then put on gel on two fingers. They use two fingers inside, and then their hand on your abdomen, and they will feel your uterus. After the vaginal exam, your doctor may put one finger, again gloved with gel, inside your rectum. This is again to check for any unusual tenderness or any masses or any growths. In other countries, there's also an ultrasound done, or where I'm working, I don't know about in other places, but I'm sure that is routine in every other place. They will do an ultrasound. The ultrasound is usually like a vaginal ultrasound, which goes again inside, and it is to check the uterus, the size, and for any kind of abnormality, and also to check the adnexa and your bladder. With every part of your exam, the doctor will be informing you of what they are doing, from looking outside and from examining, from the ultrasounds, everything. Your doctor is going to be keeping you informed step by step. Like, now I'm checking for this, this is what I'm doing, now I'm going to do this. Are you okay? Are you comfortable? That's how the gynecological exam is basically done. And if there are any kind of tests that are done, you'll be informed of the date or the time that you should be expecting results. Usually in a few days, the pap smear results will be out. And if there's any problem, the doctor will call you and let you know, or call you to their office and let you know of their results if there's any kind of abnormality or any kind of problem. And then if everything is okay, you'll be called to come for a checkup the following year, which is how it is done actually. And yeah, that's all for today. Comment if you have any questions, and I'll be more than ready to answer your questions. See you in my next video. Bye.